Dieting before and after bariatric surgery. There are millions of Americans who are overweight, and many of these people are actually considered obese. When it comes to extreme obesity, many people feel that there is absolutely nothing that they can do for themselves, and so they give up trying to live a normal, healthy, and happy life. But for many people who are extremely obese, there is an answer: bariatric surgery. This is an extreme measure and really should only be used as a last resort, but for many, it is the only option that they have left, because regular diets just are not working for them and their extreme weight is causing health problems. Some of the health issues that obese people often deal with are heart disease, kidney disease, and diabetes. What is bariatric surgery? Bariatric surgery is a last option for many people who are extremely obese and unable to lose weight on their own. There are a number of different types of bariatric surgery, but the most commonly performed weight loss surgeries are gastric band surgery, gastric sleeve surgery, and Roux-en-Y gastric bypass surgery. Gastric band surgery: this is a weight loss surgery that uses an adjustable silicone band, helping to reduce the size of the stomach. This type of surgery helps to eliminate up to 60% of the excess weight, and patients are usually able to return to work a couple of weeks after the operation. This is a surgical procedure that helps to reduce high blood pressure, as well as the risk of developing diabetes. Gastric sleeve surgery: with this type of bariatric surgery, weight loss is rapid and 60 to 80% of the excess weight can be expected to be lost. There is a slightly longer recuperation time, and patients can usually return to work within 3 to 4 weeks. Gastric sleeve surgery helps to ease many medical problems and reduce the risk of developing others. Roux-en-Y gastric bypass surgery: patients can expect rapid weight loss, and depending on how much weight they need to lose, they may do so within 18 months. Following this type of weight loss surgery, there is an 84% reduction in the risk of developing diabetes, and blood pressure lowers considerably. Patients usually return to work within 3 or 4 weeks of having this surgery. Can you be too overweight for bariatric surgery? There are occasions when a patient is just far too obese to be able to have bariatric surgery safely. When this is the case, most physicians will order their patients to lose a certain amount of weight before they can have the surgery. In fact, many physicians will refuse to perform any bariatric surgery on patients who are too obese, unless they have other health complications that make the surgery absolutely necessary. For many, this seems strange, because the reason they want the surgery is to lose the weight they have been unable to lose on their own, and they fear that they will not be able to lose enough to be able to have the surgery. It is necessary for them to follow a very strict diet that is rich in the proper nutrients, but low in calories, bad fats, and bad carbohydrates, which are proven to inhibit the weight loss process. If the patient is unable to follow such a strict diet on their own and they are so obese that it is actually life-threatening, they may actually be admitted into a hospital, so their diets can be strictly and constantly monitored. For many people, this is the only way they are going to lose enough weight to have the bariatric surgery safely. Anyone who is planning on having bariatric surgery, whether they are too overweight for the surgery or not, should practice following a healthy diet well before the surgery. After all, they are going to have to do this following the surgery, and if they are already eating healthy, they won't have to make too many changes following their surgery. But it is important for them to remember that they need to follow the right type of diet. Don't bother with fad diets. Many people who are extremely overweight and many who are not all that overweight, try some of the hundreds of fad diets that are out there, only to find themselves greatly disappointed in the end. Fad diets do not work, and in fact, some are actually extremely bad for your health. Often, these diets do not provide enough of the nutrients that we all need in order to be healthy, and they can actually make some people sick. And there is actually very little weight loss taking place when one is on a fad diet. Yes, a few pounds may be lost initially, but as soon as the dieter goes off the fad diet and back to their normal eating habits, they will more than likely gain that weight back, along with additional weight. The only truly healthy way to lose weight is to eat a healthy, well-balanced diet that will provide all of the essential vitamins and nutrients that can only come from healthy foods and, when necessary, dietary supplements. The right way to diet: the absolute best way to go about losing weight is to exercise and eat right. For many who are extremely obese, exercise is probably minimal, but every little bit counts. A lot of people think that eating healthy means starving, and this can scare a lot of people from trying to lose their weight on their own. This is far from the truth. Dieting does not mean starving. In fact, most physicians and dietitians will actually recommend that people eat many meals throughout the day, rather than 3 large ones. It is important to snack between meals, not only to ward off cravings, but also to get the energy needed to perform daily tasks. It is necessary to continue this type of diet following weight loss surgery, in order to make the surgery effective. There are 3 things that we all need to have in our diets and in certain amounts: protein, carbohydrates, and fats. For most people, the American Heart Association and other health organizations recommend that they follow a diet that is made up of 50% good carbohydrates, 15% good fats, and 35% proteins. These are all essential macronutrients that can be found in many healthy foods. For the person who is extremely obese, the amounts may be changed somewhat, depending on their dietary needs, but they will still be eating a diet that has these macronutrients. It is also important to make sure that there are specific vitamins in the diet, and if they are not coming from the foods that are eating, there are many vitamin supplements out there that they can use. Protein supplements can help and many are very diet-friendly. ProfectR, a liquid protein shot from Protica, is an excellent choice of protein supplement for those who are extremely obese. It provides 25 grams of protein in each 2.9 fluid ounce serving, but only contains 100 calories. It has no bad fats or carbohydrates and also has no cholesterol. And as an added bonus, ProfectR will provide users with 100% of the daily recommended amount of vitamin C, 50% of the B-complex vitamins they need, and it also contains the following nutrients: lysine, thiamine, riboflavin, folic acid, and much more. For more information about ProfectR, or any of the other nutritional supplements available from Protica, you can visit the website at www.protica.com.